Okay, this is our NATA position statement. We have sudden death in sport and we have diabetes. I'm Taylor and this is Lorena. Okay, a background on diabetes. Diabetes mellitus is a chronic metabolic disorder characterized by hyperglycemia caused by either absolute insulin deficiency or resistance to the action of insulin at the cellular level, which results in inability to regulate blood glucose levels within normal range of 70 to 110. So type 1 and type 2 diabetes, there are two different types, of course. Type 1 diabetes is when the pancreas does not make insulin because the body's immune system attacks the islet cells in the pancreas that produce insulin. And usually people are born with type 1 diabetes. When it comes to type 2, the pancreas makes less insulin that is then used too, and your body becomes resistant to insulin, which means that your body has insulin, but it's not producing anymore and it stops using it. With type 2 diabetes, people usually they're not born with this. They can get this with either their diet, they're not exercising enough, or they're obese.
Okay, so as far as the current issue, first of all, the clinician must know the signs and symptoms for hyper and hypoglycemic reactions, especially during activity with diabetic patients. Additionally, I found some research regarding the issue of gaps in care from the transition of adolescence to adulthood. So there's been several studies that because of lack of insurance or deficiencies in training of the healthcare professional, in the delivery of care for adults versus for adolescents. There's also limited evidence on diabetes care plan transitions for this time period for diabetic patients. There's also an issue with the ability to control glucose levels among different age groups. And diabetes prevalence has unfortunately increased in the recent years, adding to the diabetic issue. And there's lack of evidence, as I said, supporting specific criteria for effective diabetes care plans.
So when it comes to recommendations, of course, we're going to do a pre-participation physical exam. And then we're also going to have some supplies and the athletic training kits. We're also going to recognize, treat, and prevent hypoglycemia or hyperglycemia. And then we're also going to go through like a diabetes care plan for the patient and insulin administration. So when it comes to the pre-participation exam, there's a question on the general medical questions where it asks uh, if they are currently, if they have diabetes or not. So they'll check yes or no, and then we'll ask a little about their family history regarding if their family by any chance has diabetes and if they are a person that might retain it too. And if so, then we're going to monitor them and of course take note of that patient that they have diabetes. For the supplies and the athletic training kits, of course, these are supplies that are used to treat diabetes related emergencies, and these should be available at all practices and games. So as athletic trainers, we're going to have a copy of the diabetes care plan in the kit. We're going to have a blood glucose monitoring equipment and supplies. Before we do the blood glucose, we're going to check the expiration dates of all the supplies, such as the blood glucose testing strips, insulin. We're going to do that on a regular basis. Blood glucose testing strips have a code number located on the outside of the test strip vial. The code number on the blood glucose meter and test strip vial must match. We're also going to have like little sugary snacks to treat hypoglycemia. So that includes like glucose tablets, sugar packets, or any sugary fluids. So as we just did in the lab, some of us had apple juice and it helped bring our blood glucose levels up. We're also going to have a sharps container. So when if someone has to inject insulin or anything, we have the proper disposable, just the way to dispose it. And then we're gonna have spare batteries for the glucometers just in case ours by chance is dead. But if we're checking on a regular basis, hopefully we'll before practices and games, they'll all have batteries and will be working.
Okay, and moving into the recommendation specific for prevention. So the NATA position statement does recommend exercise for type 1 diabetics, but does recognize that there is a significant glucose disturbance that comes with exertion and physical activity. And when talking about prevention, it's important to understand a couple of different metabolic states that can happen. So the first one is ketoacidosis. So ketoacidosis is a pathologically high serum and urine concentration of ketone bodies. And ketosis is when the body burns fat for energy instead of glucose. So the NATA position statement recognizes hypoglycemia and hyperglycemia with or without the presence of ketosis, as well as hyperglycemia with ketoacidosis. So, as far as prevention, our first way we prevent is by having in place a diabetes care plan that is specific to the patient. And this is an agreed upon collaboration between the athlete, the athletic trainer, and the physician, where there are agreed upon glucose levels that deem safe for the athlete to participate in sport. Number two, the recommendation is preventing hypoglycemia. So preventing hypoglycemia happens in three parts. The first is frequent blood glucose monitoring. Second is carbohydrate supplementation, and the third is insulin adjustments. So, for a diabetic athlete who often experiences hypoglycemia, it is important to check their glucose levels 2 to 3 times before activity, every 30 minutes during activity, and every hour up to 4 hours after activity. And carbohydrate supplementation should be available before, during, and after activity. As far as recommendations for recognition, the NATA position statement says that recognition of hypoglycemia comes with tachycardia, sweating, heart palpitations, hunger, nervousness, headache, and dizziness. As previously mentioned, they recognize hyperglycemia with ketosis. Again, ketosis is when the body burns fat for energy instead of glucose, and this will present as nausea, dehydration, reduced cognitive performance, sluggishness, and fatigue. And then the third recommendation for recognition is for patients with hyperglycemia with ketoacidosis. So this presents as Kussmaul breathing, fruity odor in the breath, unusual fatigue, sleepiness, loss of appetite, thirst, and frequent urination. For the recommendations as far as treatment and management, so the NATA position statement says that athletic trainers must follow all ADA guidelines, which is the American Diabetes Association guidelines for exercise specific to hyperglycemia and hypoglycemia. So, with patients experiencing mild hypoglycemia, this is defined as a patient who is conscious, able to swallow, and follow directions. With this patient, we're going to administer 10 to 15 grams of carbohydrate, and we are going to reassess their glucose immediately and 15 minutes post administration of carbohydrates. A patient who is experiencing severe hypoglycemia, they are unconscious, unable to swallow, unable to follow directions. This is an emergency, and this is where we activate our EAP. And if we have a properly trained athletic trainer or clinician present, they are going to administer glucagon. As far as treatment and management, again, we are going to follow the American Diabetes Association guidelines. And as far as return to play, physicians are the ones that are going to determine safe glucose ranges for post-mild hypoglycemia and severe hypoglycemia, as well as hyperglycemia.
And then these are our discussion questions. Identify some challenges with recognizing a patient experiencing a diabetic hypo or hyperglycemic episode. How can athletic trainers assist in the transition of care from adolescence to adulthood? And then what would you consider as part of return to play criteria?
So, as previously mentioned, one of the challenges is that there is no set return to play criteria for patients who experience hypo or hyperglycemic episodes. So this is one of the challenges athletic trainers face, and we just want to know what your ideas are as far as coming up with ideas for these challenges. And these are our references, and thank you for listening.